Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of May 24th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has 88,545 recorded COVID cases and 1,679 deaths. Cases continue to come down, as does our COVID positivity rate, and vaccination rates continue to go up, with almost 77% of those who are 16 and up having had at least one dose, and almost 62% of those 16 and up being fully vaccinated. As you'll recall, we now have the vaccine available for those age 12 and up. So soon we expect to see these percentages reflect the eligible population, which is 12 and up. So we may see the percentages actually start to look like smaller numbers, but that is because we have a larger eligible population. So we will be keeping an eye on the percentage of eligible as we continue to vaccinate the younger population. Oakland is a little behind the county of Alameda, with 74% of those 16 and up having received one dose and 58% being fully vaccinated. And we know that even within Oakland, we are seeing big disparities in terms of vaccination rate. For example, in the 94611 zip code, 77% of people are fully vaccinated, whereas we have 4 zip codes in East Oakland that have vaccination rates that are under 50%. And those are the 94601, 94603, 94621, and 94605. And then also parts of Hayward are also having low vaccination rates as well. And these maps certainly look familiar with these same exact zip codes, because we've been looking at them pretty much week after week as the zip codes with the highest case rates, the lowest testing rates, and the highest test positivity rates, and now the lowest vaccination rates. But the good news is that the numbers are coming up, maybe more slowly than in other areas, but we are seeing them increase week after week after week. Now, the United States, and in particular California, are performing quite well as it relates to both vaccination rates as well as our case rates continuing to come down and level off. There are some areas that are still experiencing surges, and in particular, the countries that have the highest case rates and death rates still are India, Brazil, the United States, and Argentina. And so even though we are decreasing, we are still comprising a huge number of cases and deaths. And we've certainly improved since our winter surge, when we were seeing the high 3,000s to low 4,000s of deaths per day. And now we're more like in the 500 to 600 deaths per day range, which is not good, but it is certainly improvement for our wintertime spike. And so we are certainly hopeful that we will continue to go in that direction. Now, worldwide, we are definitely seeing that the different variants seem to be playing a role in what's going on. And in countries that have really high transmission rates, that's where we're concerned that the virus keeps replicating, and we are concerned about variants that we haven't yet seen yet. So of the variants that we have seen so far and that are circulating around in the United States, the good news is that all of our vaccines are providing protection. Now, we don't know if they're providing the same level of protection as they do against the original or the wild type COVID-19, but they are providing some protection. And you can see here that this is the variant report from the CDC website, and it is showing how the variants have changed month to month or so. And you can see here that the B117 has been increasing pretty dramatically, more in some states than in other states. But this is an average across the United States. And based on the limited still surveillance that's being done, this is what we're seeing, or the B117, or the type that was first identified in the UK, is really becoming the dominant strain. But we have some others that you can see here that are variants of concern. Now, on the far right there at the bottom, that darker purple is the B1617, which is the variant that was first encountered in India. So we know that we're seeing it here in the United States. One of the challenges is we are still only sequencing a small percentage of positives. So we don't always know exactly just how common these variants are. And secondly, is that the B1617 has not yet been named a variant of concern by the CDC. And so that means that we may not have as much detection going on because the labs have not necessarily added this onto the variants that they will be reporting to the public health departments. And so we are definitely keeping an eye out to see if that variant in particular is going to cause us any outbreaks or issues here in the United States. We know that we are seeing cases. We just don't know exactly how widespread those are. So overall, things going in a good direction in the United States, but really worldwide, we really are still in the midst of this pandemic. Overall, case rates and death rates are still not even down to where we were, let's say, back in October. So we are hoping to see the trend that is happening in many countries continue to come down, and we'll continue to keep an eye on those places that are continuing to increase and face real challenges still to this day. So now here in the United States, we feel that we are still sort of in a race in terms of vaccination versus the variants. And so we want to make sure that people are still getting good, accurate, solid information about the vaccine to make the best decision that they can for themselves. And we're having to do that amidst a scenario where there are just a lot of myths spreading around and being fueled by different groups. And one of those myths that seems to be pretty prevalent right now is this one about shedding. And it was kind of difficult to get to the bottom of where this really myth came from, because it seems to be getting so confused into so many different topics that it was a little hard to sort out. But there have been claims that just being near someone who was vaccinated, that somehow those vaccinated individuals could somehow be leaking something out of their body that then goes to other people and causes a problem in those other people. And so we even saw businesses like in Canada that wouldn't allow vaccinated people inside, and a school in Florida that wouldn't allow vaccinated people to come in. And so this is obviously creating some issues, and we wanted to try to get to the bottom of where this came from. And so vaccine shedding is actually a term that's used to describe the release of vaccine components outside of the body. And then there's virus shedding, which is when the virus keeps on discharging particles outside of the body. So these are actually two different things that I think it is important to sort out. People who shed in general virus particles are people who have the virus. So you can't shed viral particles unless you actually have the virus. And that is actually what we call being contagious. So if you have SARS-CoV-2 and you are contagious, that means you are shedding these particles out of your nose, out of your mouth. We know that particles actually get shed through other means like fecal matter and urine, but we really aren't sure if those are really spreading much disease. We know by far that the main way that we are spreading SARS-CoV-2 is through aerosol and then through droplet transmission, and then through surface transmission. And those are the primary ways that SARS-CoV-2 is spread. And so when we say that you're still shedding the virus, then that means that you're testing positive. It means that you have viral particles that are coming out of you. It doesn't necessarily say that you're contagious or not, but it means that you're still shedding out those viral particles. And that can happen if and when you are actually infected with SARS-CoV-2. Now, the vaccine. So vaccine shedding could happen only when the vaccine actually contains the virus in it. And we do have vaccines that contain virus in them, just not the COVID-19 vaccines, but we do have other vaccines that contain a weak version of the virus. And another way of saying this is live attenuated vaccines. So when you see that on the vaccine, live attenuated vaccine, that means that you have the actual virus and it was weakened. And then that is what's being given to you in order to make you mount an immune response. So basically, it sort of gives you a weak version that's not enough to cause you to get the disease, but it's enough to have you mount an immune response. And none of the COVID-19 vaccines that are approved right now in the United States contain any live virus. There are a number of vaccines around the world. They're in different stages of the pipeline, and some are using a live attenuated virus sort of a platform. Those just aren't the ones that we have here. So as a reminder, the main vaccines that we have here are the mRNA vaccines. We also have the adenovirus vector vaccine, which is the Johnson & Johnson. But basically, the way that the mRNA vaccines, the main ones that we have, work is that they have the instructions for our body to create a small and harmless piece of just one of SARS-CoV-2's proteins. And SARS-CoV-2 has a number of proteins. And we're just, with the mRNA vaccine, getting a instruction to make a small piece of one of the proteins. And then, as you'll recall, those instructions disappear quite quickly. In fact, one of the biggest challenges with the mRNA vaccines is to keep it around long enough to actually allow us to make that piece of a protein so that we can then create antibodies, and then we will be prepared if we are ever presented with the real SARS-CoV-2, then we will be all ready to fight it. And so that there's nothing live in there. There's no live virus inside of those vaccines, just this instruction to make this piece of a protein. And a piece of a protein, inside of our bodies, it causes us to make antibodies, again, so that we can fight it if we get the real thing. But outside of the body, it doesn't do anything. It can't get anybody else sick. Really isn't anything. And so there's no way that can do anything to anyone. What people mean when they say vaccine shedding is with the live attenuated vaccines, and I'll tell you which ones we have that are live attenuated vaccines currently in the United States. Those would be like the MMR, the measles, mumps, rubella vaccine, also the chickenpox and shingles vaccine, and also the nasal flu spray. And so that's actually why the nasal vaccine for flu, you can't get it in certain conditions, like if you have a weakened immune system, because we don't want you to have the live attenuated vaccine. We'd rather give you a completely killed vaccine. And so there's different types of flu vaccines. One of them, the spray, is live attenuated, and then the others that are injected are not. And so that is why there's a little bit different instructions when it comes to these different vaccines, and different people, may have different precautions. When you get any vaccine, you are given a piece of paper that looks like this, the vaccine information statement. And for the COVID-19, because they're not fully licensed, we don't have this vaccine information statement. We have the emergency use authorization documentation. So either way, you should be getting documentation about the vaccine that you get. It tells you all the things that you should be looking for. It also tells you what to do if you get any kind of adverse reaction. And here you can see this is the vaccine information statement for the live nasal spray flu vaccine. And you can see this highlighted part here that I highlighted says that if you care for a severely immunocompromised person who requires a protected environment, that you need to tell the person who's giving you the vaccine. And why is that? Because they're going to tell you just to be careful because you may have some vaccine shedding. And if you're taking care of someone who's severely immunocompromised, then we're going to tell you to do things like be really careful, wash your hands after you use the bathroom. If you cannot share a bathroom for a few days, depending on which, vaccine this is, then we'll want you to not share a bathroom for a number of days. And so these are precautions that we give, even though, in real life, it's very, very rare for actually anything to pass on the actual illness. But we know that this is plausible with these live attenuated vaccines, and that's why we give the warning. With the 3 COVID-19 vaccines, it's not plausible. There just isn't any way. So these are not live vaccines. There's nothing to be shed. And so there's nothing that can go to other individuals in your vicinity. And so we want to make sure that not only is that clear, but also the other piece of this myth, which again made it a little difficult to understand where it was coming from and where it was going, frankly, is that it talked about that if you are female and around other people who got the vaccine, then this could somehow change your menstrual cycle. And again, a little bit difficult to understand how these things are connected, although we talk about a woman's cycle being shedding of the uterine lining, two different, completely kinds of different shedding. And so somehow these two things seem to have gotten confused with one another. But the fact of the matter is that you cannot pass anything to another person from having the vaccine. Now, if you have COVID, that's a whole other story. So we do need to be concerned about people who have COVID, who are spreading COVID around, but vaccinated people simply are not shedding anything that they can pass on to anyone. Now, what about this part about can the vaccine actually cause any reproductive challenges with women? And so we know that in the vaccine clinical trials, there actually were a number of women who got pregnant during those trials. This wasn't something that was specifically included in the trials or excluded. And so with that many women in the trial, then some women simply got pregnant during that time period. And all of the women who were in the vaccine group who got pregnant, and there were a total of 23, all had healthy babies. And in the placebo group, there was unfortunately one woman who did lose a pregnancy, but again, that was not in the vaccine group, that was in the placebo group. And these things unfortunately do happen again spontaneously. And so, but we could see very clearly that the women in the vaccine group who did get pregnant were able to deliver healthy children, and that we have no reason to believe that the vaccine caused any issues at all. There have been many anecdotal reports of the vaccine causing changes in women's menstrual cycles, and these are appearing to be short-term effects, just like all of the anticipated effects of the vaccine are all short-lived. And we do have evidence from other vaccines like the flu vaccine and the HPV vaccines that they also can affect temporarily women's cycles. But again, these are not long-term impacts. They're short-term, just like the fever and chills and the arm pain. And so we do need more studies to really determine whether there's actually an increased incidence of this happening, but there's absolutely just no evidence that this is causing any issues with fertility or with pregnancies or anything related to a woman's reproductive system. In fact, we know that pregnant women tend to do worse when they get COVID-19. So we do want to make sure that women who are pregnant are protecting themselves and their growing baby by sheltering in place, being cautious, wearing a mask, and talking with your OBGYN about getting the COVID-19 vaccine, which is being universally recommended by all of the different associations that look after women who are pregnant. So I hope that I have covered all aspects of this myth that has been swirling around, please do submit any additional questions in the chat by direct message or email to admin@rootsclinic.org. And if there's other myths that you would like us to break down, please send those along as well. So until then, we are going to continue with our layers of protection, which include vaccination for all those who are eligible, which is everyone age 12 and up, masking and spacing. And this is a properly fitting mask and spacing, particularly in indoor spaces. Testing and quarantine. We're going to want anybody with symptoms to go ahead and get tested, whether you are vaccinated or not. If you have been exposed and you are unvaccinated, please do get tested within 5 to 8 days. If you're symptomatic, get tested right away, and please continue to isolate yourself until you receive your results. We are still seeing positives every day at our testing site. And even though the numbers are coming down, they're still disproportionately high in the same areas, including in East Oakland. And we are seeing an increase of the different variants, and they're right here in Oakland and in Alameda County. And so if you are unvaccinated, you remain vulnerable to COVID-19 and potentially to these more contagious and more dangerous variants. So we want you to just be that much more cautious. And if you are indoors, the most important thing is to not be in crowded, poorly ventilated spaces. So ventilation is the fresh air circulation, or the HVAC that is exchanging the air at the appropriate rate. If you're relying on HVAC, then the filtration is very important, a MERV 13 filter or higher. And disinfection and sanitization of especially your high touch surfaces is also important. Make sure that you are eating well, you are getting regular activity, you are sleeping well and keeping your stress levels managed. Take a multivitamin and additional vitamin D supplementation. And this concludes today's People's Health Briefing. Thanks for joining us. Please tune in next Tuesday at 10. See you then.